Hi, everyone. So I'm here today with Jennifer Tietjen, LCSW, and she's one of our therapists and EMDR specialists at Passages Wellness and Counseling for Women. Hi, Jen.
Hello, thanks for having
So,
me.
yeah, thank you for coming. How are you?
I'm good. How are you?
Good. Good, thank you. I'm looking forward to our conversation today. So, I wanted to talk with you and have you talk to our audience about this incredible but really interesting thing called EMDR. And I think just right off the bat, I think people just want to know what is EMDR. They've seen it lots of places, might have heard Prince Harry was doing it, it's on TV shows. So, what is EMDR?
Yeah, so EMDR stands for eye movement, desensitization, and reprocessing. It is a treatment modality that is designed to kind of help with any sort of distress from traumatic experiences. So it was initially founded as a treatment for trauma, but we know now that it actually works for many, many different things, something like even anxiety and depression.
Awesome, yeah. So it's widely used. And I know for you, we can get into a little bit more about the ideal client, but I know you use it a lot. So before we get into the ideal client, can you tell me just a little bit if somebody was contemplating or heard about it and thought it might be helpful for them, like what happens in the therapy room? I know that some people might be hesitant or a little bit nervous. Is it too woo-woo? Can you explain a little bit about some of the basics of EMDR?
Yeah, so it is different than your traditional talk therapy. You're not doing as much talking, so to say, when you're using EMDR. But in the beginning, it looks a little bit more like your basic therapy. We're talking, we're getting to know one another, kind of treatment planning. I'm teaching you coping skills, things along those lines. And then when we get into, so EMDR is 8 phases. When we get towards phase 4, that's where we start to utilize what we call bilateral stimulation. So bilateral stimulation is eye movements. That's probably what you see more of on TV. The therapist is sitting in front of them, yep, with their hands going back and forth, and you're following with your eyes. It can also be sounds or tappers. There's many different ways to utilize BLS.
Okay, so it's bilateral stimulation. So it's left and right. Yeah. What's the point of that? Like what, from I know we're not like neurologists or, but and it's still a little bit of a mystery of exactly how EMDR works even in the field, but what would you say is the general thought behind why bilateral stimulation when talking or bringing up a distressing situation?
Yeah, so we use it because we're trying to change the way that the memory is stored in the body. So you might be familiar with REM sleep, the rapid eye movement sleep. So our eyes are kind of doing the same thing, going back and forth. It's when we dream, and it's when our brain is kind of storing the things from the day, our experiences, what's going on, short-term memory, long-term memory. So I guess they think that that's what we're recreating in using bilateral stimulation with EMDR. So we're recreating that experience to shift how our memories are stored in
Yeah.
our brain,
Yeah.
focusing on emotions, body sensations, that sort of stuff.
Yeah. Because you might have seen this, like some clients will feel more of the body sensations, some people won't. Some people will have a great, significant, clear image, and some won't really have as much of an image, but and it's fragmented, right? And so, yeah, so I'm imagining as I saw your fingers, like it's pulling those fragments together and telling the story, in a different way. So, but that's it. Like you just keep checking in while you're doing that, and then what happens?
So we're quiet when when the bilateral stimulation is happening. We're not talking, and it goes on for, I don't know, 30 seconds, 20, 30 seconds, something around there. We stop, and then I ask the client to tell me, okay, what are you noticing? And they tell me what's going on, what's coming up in their brain. Okay, good, go with that. And we go back into the bilateral stimulation. So we're hoping that the more we do that, we're desensitizing the memory. So the level of distress that it was initially bringing up is becoming less and less until we are eventually done with that target.
Okay, that's great. But does it really work? I mean, does
I
it?
know. I mean, it does. And I probably wouldn't believe it if I didn't see it with my own eyes, but it does. It does really work. And people in many less sessions than, they may have been in therapy for years and saying
Yeah.
nothing's working. And all of a sudden, within a few months, they're feeling so much better thanks to EMDR.
Wow. Yeah. So it works. So, I know it's that phrase that those of us in the field have heard so many times, the body keeps the score. I think this is good evidence of that. Like there's literally a score of how disturbing it feels. And I know that you've had the experience of having clients reduce that disturbance. Yeah, that's
Yeah.
great. Um, so who is a good candidate for EMDR?
So really anybody can be. I definitely use it a lot in many of my sessions, whether it is the full 8 phases of EMDR or just pulling different things. Maybe we're just focusing more on body sensations and doing a little more work in that area. Maybe we're just teaching coping skills that come from EMDR, but really anybody can be a candidate for EMDR.
That's awesome. And I think so. Do you have to be like to use any of the skills that you've learned, or for a client to benefit? Do they have to be in like specifically devoted, like long sessions or intensives?
Not necessarily. We can definitely use it I tend to lean more towards an hour than 45 minutes, but you can definitely use it in an hour session once a week. Sometimes people need once every other week, which
Yeah.
just takes a little bit longer, but it is possible to do it.
Wow. Yeah, that's awesome. So, it sounds like a great treatment that has wide application. You're going to keep using it, I'm assuming. It's one of
Yes,
the, yeah, it's one of my favorite tools. I don't know if it's one of your favorite tools in the
definitely.
toolbox.
And I could talk
Yeah.
about it forever. So,
Yeah, there is plenty to say. So with that, I think what we'll leave here is that if any of you are more, if you're interested in hearing more, anything specific, any specific questions about EMDR, anything that you've heard, any myths, who knows what, but feel free to leave a comment here, email us, write to us at Passages, but we would love to talk more about this. Jen, I'd love to have you back because you're certainly one of our experts and would love to hear more from you if you're willing. That'd be
yes,
great.
definitely.
Okay, very good. Thank you. And so, again, leave a comment. And if you like what you're hearing in our videos and you are enjoying what we are doing here at Passages, then please subscribe to the channel. So, that's really all we have for today. We thank you so much for watching and take good care of yourselves. Bye bye.